Hi, I'm Dr. Horowitz, and I want to thank everybody for coming today to hear about the LiteLift. Dr. Nichter and I are not available. We're out of town, and we hope that this will be informational for you and you have a good time.
You'll learn today from everyone here, including some of the patients that have had this procedure, what a wonderful operation the LiteLift is.
The LiteLift is a modified facelift that can be done in our office under local anesthetic. The LiteLift has shorter incisions, it's less invasive, and has a much quicker recovery time.
Our best candidates are those patients which typically are in their late 30s to 60s. That is, those patients with good elasticity of their skin. However, we rely more on good health, that is physiological age and not chronological age. So even if you're in your 70s or even 80s, early 80s, and you have excellent health and you're not on a bunch of heart medicines, haven't had a heart attack, and exercise daily, we'd much rather operate on a patient like that than someone who is far younger with lots of medical problems. And they also enjoy some wonderful results from this procedure.
The LiteLift operation is different than a traditional facelift in several ways. The traditional facelift is the operation that all plastic surgeons learned how to do during their residency. Most plastic surgeons continue to do the same operation. Our patients came to the office and said, we want to have an operation that's an easier operation that looks natural, that doesn't have a windswept look, and is more affordable. We changed our technique in a number of different ways to meet the needs of our patients. LiteLift has shorter incisions, can be done in the office under a local anesthetic, and the recovery is usually only 5 to 7 days.
And I answer this question in two different ways. The first one is, and many of you will roll your eyes back when I say this, is that it'll last forever. And I love to use the identical twin analogy. Let's say that you had an identical twin, and that one of you had, let's say you, for example, had a facelift, a LiteLift, and your twin did not. Well, from that time forward, you will always look younger than your identical twin. 5 years from now, 10 years from now, or 20 years from now, you'll always look so many years younger. But that doesn't mean that you stop the clock of time and normal aging. You don't jump on the clock and break it. It keeps on ticking. So that in 5 or 10 years, you'll look 5 or 10 years older rather than you did right after you recovered from it. But you'll always have those long-lasting effects.
Many patients come to the office and they're concerned that the facelift will leave them looking too tight, too pulled, or with a windswept look. The LiteLift, the way we perform it, leaves our patients looking natural. The muscles are tightened, but tightened just enough to give you a very natural appearance, but correct the neck and the face that most patients want to have changed.
Another common question that's asked is, how long is recovery? And this actually varies from person to person. Some people tend to bruise more than others. Others tend to swell more than others. And so there's a wide range of what it takes. However, the recovery is accelerated tremendously from a traditional facelift, about half the time. So typically I tell my patients 1 to 2 weeks they should be ready to be able to go out in public. If you have more than one procedure, like for example, say you had a LiteLift and you had your eyes done, a blepharoplasty, and you also had a chemical peel, like a blue peel, that would probably increase recovery time by not too long, but maybe 3, 4, 5 extra days. But typically people recover very fast, and with light cover-up makeup are able to go out in public in 1 to 2 weeks.
Local anesthesia is perfect for most of our patients. However, because we are board-certified plastic surgeons, our patients have the option of having a twilight anesthesia or even a general anesthesia if that will make them feel more comfortable.
Dr. Horowitz and I have been performing this procedure for the past 8 years, was the first one I did, with increasing frequencies. We do approximately in the office 3 to 5 of these LiteLift procedures per week. We've been performing facelift procedures, however, for more than 25 years, and we're just thrilled to be able to offer you a lot of the new advances that we've helped modify and improve upon a long-lasting result through a minimally invasive procedure. Thanks again for coming. I hope you enjoy the rest of the evening.
We want to thank everybody for coming today. We hope you had a good time, and we hope you learned a lot about the LiteLift, and all of your questions were answered today. If you have any more questions after this brief introduction, call the office or make an appointment to see Dr. Nichter or myself or one of the consultants. Thanks again for coming.